This conference will now be recorded.
All right, welcome at this webinar. Today it's a special edition because we have some international guests in the house, so that's really beautiful. This webinar is organized by MedScaler, and they have a special guest for us. It's Prevect, and Prevect is a company from Sweden, and they are really a game changer in addiction treatment. So I would like to hand over the camera to Marcus and Maria. The floor is yours, and please let us know what you're doing in Sweden.
Thank you.
Thanks.
And really welcome for this webinar today about digital addiction treatment with Prevect. I'm Maria Winkvist, and I'm Product and Marketing Manager at Kontigo Care in Sweden. And with me, I have Marcus Söderqvist, who is responsible for service and support. And we will try to explain what Prevect does and how it works. And the webinar will be divided in different parts. First, I will present a little bit what it is and how it works. And then we will have time for a few questions. And if you have a question, just type it in on, and then the question will be read out, or you will be asked to tell the question, and we will try to answer that one. And then we will have a demo, which Marcus will perform for us. And after that, it will be time for questions. And if you have more questions that we have time with today, then if you send in your email address, we will try to answer all questions that will be. So I think we should start the presentation, and I will move in. So, Marcus, ska vi ta ner för att se presentationen? Let's go into presentation mode. So we're a company in Sweden, as I just told, and what we will talk about today will be a platform for digital addiction treatment, which is called Prevect. It started with the best pitch ever. Me and a few colleagues of mine was really hooked on a dream to be able to stop a relapse in addiction already before it occurred. Think if it was possible with cool technology, which is today possible with computers and with different digital tools like with the mobile, and to collect a lot of information and try to find patterns. Patterns would indicate early signs of relapses. And think if it was possible to also collect all this knowledge and this kind of gut feeling that really experienced therapists have, that they said that they could feel that a patient was moving towards a relapse. Think if it was possible to combine all these kind of factors and create a tool that would be both beneficial for the patient suffering from the addiction and for the healthcare provider to be able to support the patient in a totally new way. It's also about our founder, Daniel, a very well-known entrepreneur in Sweden and also abroad. And he was actually fighting with his own addiction. He basically lost job, family, and almost his life. And from an idea to build something where you could kind of measure and do breath tests on a daily basis together with a lot of support and different kinds of support tools that could kind of create a total new way of giving addiction treatment. And there the start of Prevect was. So Prevect is a medical device, and it's performed most of the treatment in the home and home environment of the patient with the mobile phone and a small breathalyzer. And the patient have a kind of individual treatment program set up by a healthcare professional and perform most of the assignments in their own home by doing breath tests, answering questionnaires, doing a lot of activities with the mobile. And all information is sent up to the cloud and to the healthcare professional in real time, and are presenting in a totally new way. So you could see a risk of relapses, you could directly see how it goes for the patient, so you can monitor them at distance in a totally new way. And all this kind of information is also collected into kind of risk assessments of risk of falling into a relapse or close coming relapse. So Predict for the patient means that it's a kind of a digital coach. So you will have this small breathalyzer with you wherever you are, and you will have the app. And in the app, you have built kind of a treatment program. So you can track behavior changes, you can identify relapse triggers. You will have help to structure everyday life. Quite often these patients have a problem that they have lost kind of good routines and structure that will be of great benefit for the recovery process. And you will get motivated as a patient to see your own progress in that, but also a very good feeling that all this information is sent from you, and if something would happen to you and if you feel not as good, the healthcare professional will immediately see this information and could act on it. And it's also possible to share this information with relatives or a kind of workplace if you would like to do so. For some patients, that becomes a really good support. And for the healthcare professional, it means that you will have knowledge-based information from the patient in real time. It means that you could get a totally new way to prioritize the patient, since you have this kind of index of risk of relapse and all other information, so you can start to categorize the patient in a new way. And that means that you can transform time, so you can give more time to those patients that are in need of more support, while the patients that are performing really well, they won't consume that much of your time. And that also means that you could start working proactive instead of reactive. So you could kind of see early signs, and you could start working with the patient where they are in a very early stage. And that means that you could kind of get less longer periods of relapses, or you could kind of try to avoid relapses from start. So this is a view from the web portal where the healthcare professional works. So what you see here is patients which are represented by happy or sad or neutral faces. So each patient will be represented by one of these cards with a happy or sad face, and also index, as you could see, going from 0 to 100. And also trend arrows. So you could see if the patients are in a positive trend or negative trend or a neutral trend. And this is, of course, very beneficial if you work with a lot of patients. So that means in the morning you could kind of take up this view, and you could directly see if you have 100 patients, which 70, for example, 70 patients that are green, and which 10 that are yellow, and the rest 20 that are red. That means, as I said earlier, that you could transform time. You do small intervention with the green ones where you see that it goes really well, and then you could kind of put more effort and time on the yellow and red patients based on information regarding each patient and how they have performed since the last days. And this is a calendar view which the healthcare providers work with when they will have more information before they meet the patient. This system is not automatic in all in the way that you should not work as a therapist. It's more that you get much more and high qualified information regarding the patient, so you can work with the patient in a really optimal way. So first of all, you can monitor if they perform the breath test. So here you see the green circles. You see also if they not perform their test and if they have alcohol in their breath test. You could also see when they have cravings. You could see if they do their assignments. You could see how they have with their well-being that will be measured each day. So, for example, if you take a look at a week, so if you meet the patient on a daily or a weekly basis or in each second week, then you could directly start to discuss what have happened the 6th, Wednesday the 6th, and you saw you have a craving but still perform their activities, that's good. But then you see the 8th, 9th and 10th, they did not perform their activities and they did not perform their breath test. And then you can kind of bring back all this information into the discussion with the patient. So the health care provider says that right now they will work more kind of knowledge-based, but also that where they can come much deeper into the sessions much faster. Information that could take perhaps months to get until the patient kind of explained and said something about it and that they should get these kind of clues, now could come up very easily and be displayed in a very easy way, so they could start the discussion in a new way. This is another way how information could be displayed. Our brains are really fantastic, right? And they could do so much more than most of the computers today. However, we are not as good as the computer to record small changes over time. So what you see here is that you have a timeline and then you have kind of different scales. And here the yellow one indicates the sobriety index, which says the kind of risk of relapse and how it goes in the treatment. And then at the same time, you see the orange line, which displays the well-being. And here you see a patient that is moving towards a kind of deep relapse. And then you could also see that the well-being is correlated, and you could especially see the purple one, which is displayed that for this patient is particular the sleep that is the problem for this patient. And this becomes very pedagogically when you talk to the patient as well, to display how everything is working and how they can gonna see their own progression over time and what kind of factors that's very important to monitor and follow over time. So in Sweden, we have been working with this system for quite some time. At this point, it's soon up to 50% of the municipalities that are working with open care in Sweden that work with the system. And what they report back, what Predict means for the patient, is a great kind of freedom. It's kind of a little bit contradictory because it's kind of something that you will be controlled by doing the breath test on a daily basis. Most of them do it like 3 times a day, but still the feeling of being able to kind of show to your relatives and to yourself and to your healthcare professional that you're actually sober is really, really great for most patients. And also that they could be in their own environment, at home or workplace or going for vacation and so on, and still they will have their treatment with them. They also means that they will have much better communication. Quite many patients will take a long time until they kind of reveal and display what's really the problem with emotions and cravings and how everything works. With this small activity that will collect all this information, it will be much easier to communicate with the healthcare professional in a new way. And of course, it's a lot of shame involved with addictions. And then it's good that it could be very discreet and you can just go to your bathroom or wherever you are to do the test, and it doesn't take a long time. And also that you have a really good feeling that if something happens to me, someone will very early see that it's something that is going on and they could help me in a new way. And it's always related to what have happened to me. It's not kind of general things, it's more kind of directly on what have happened on the stress or sleep or things that will trigger a relapse. So basically it's about right treatment at the right time to the right patients. So what does it mean for the healthcare professional? How could they work in a new way? So first of all, I showed you how you could prioritize patient in a new way. So that means if you have a lot of patients, it will be much easier to kind of give the right priority to the patient that is in need right now for more care and more help. It also means that you could start work proactive with this kind of predictions and biomarkers. It's possible actually to start seeing early signs of relapse or that the well-being is going down, so you could help that patient in a much better way. And also that you can allocate your resources and time in a new way, because you could start working with kind of very short interventions. So we have seen in the system it's possible to kind of give short feedback in the app by sending away like small text messages, emojis, or kind of small feedback on a fairly regular basis. But then you won't have these kind of long meetings. Perhaps instead of having a meeting each week, you can have it each second week. Sometimes they can take it like even longer periods between the visits, by just kind of checking the patient that everything is okay and send small messages, which means that you can kind of work and use your resources to work with those patients that are in need of more treatment. So this is unfortunately in Swedish, but we have some publications already from clinical trials which we have performed in Sweden, which are published in scientific journals, where you could read about the technology and how it correlates to the golden standard blood markers, and also that we have actually found the two first digital biomarkers for addiction treatment for alcohol addiction already. But we also have like health economic studies, which is displayed here, where we could show that the clinics that are using Predict could kind of be more efficient. They could kind of have patients that stayed longer in the treatment with quite often it's a lot of dropouts when it comes to addiction treatment, but they have kind of get more patients to go through the whole year program instead of these dropouts, that you could display and show more kind of relapses, and that especially the big savings in Sweden, if we look at those, will be that quite a lot of patient needs intoxication treatments and inpatient treatment, which is really costly. And by using this tool, they could actually avoid these costly in-house treatments and instead have open care or outpatient settings, which is more efficient. We also have a lot of clients that been in for addiction for a long time, so they have lost their jobs, or they are in high risk of losing their jobs, that by using Predict will be able to stay at the workplace and that they could work. We also have kind of figures saying that a lot of healthcare providers experience that they kind of give less or equal much of treatment, but the patient experience that they get much more treatment and higher quality of treatment. So this is kind of a big moment for us. We had our vision to one day be able to kind of stop a relapse before it occurs, and to kind of give a tool that would help patients in a totally new way. And in the Nordics, we have a big medical fair, which once a year handle out the prize for the most kind of best innovation when it comes to e-health. And 2018, we was awarded this prize from the Minister of Health as one of Sweden's most promising tool for kind of supporting healthcare professional, which is really cool for us, and of course a good show that we are kind of working on a good thing. But actually what matters most to us, we are still a very small company, is that we have these fantastic stories from families and individuals that have been using our system for a long or short time, where they have actually gained their lives back again. families that could keep their kids in the families, people that have went back to work, and where it means kind of basically everything for them. And quite often they send to Marcus here at the support. They will kind of tell their stories, or we'll get back from people that are out and telling about our system, how this have changed their lives, which is really amazing to be part of. So I think, yeah, that was my last slide. So I think now it's time for questions. So Nadia and Dorian, do you have got any questions?
Okay.
Or if you do not have question, we could kind of move on to the demo, and perhaps it will come more questions.
Yeah.
Is more questions?
No, there just came some questions.
Mm-hmm.
So let me see. Oh, this is a question from Mark. If Prefect is introduced in the Netherlands, who will pay for the solution? Whether health insurance companies will pay for the solution?
In Sweden, if we go back there, then it will be kind of offered by the healthcare professionals. You could also find it like in private clinics. In Netherlands, I think a lot of the healthcare is supported by insurances, and the clinics get kind of refunded by insurances. So I assume it will be that the patient go to the clinic which could offer Predict, and then they will get money from the insurance companies in that case.
Yeah, does that answer your question, Mark? I think, are there any additional questions from people in the audience before we go through to the demo?
I think we could kind of take more questions after the demo. Perhaps it comes up more. Yeah. Otherwise, we could tell a little bit what the most frequent questions will be in Sweden, and we'll see if it's something that will be the same in Netherlands. So I think, Marcus, could you show us?
Yes, I'm going to show you what it looks like from the patient's view. I'm going to perform a test with the breathalyzer, and I'm going to try to let you see what it looks like on screen. Let me see, here we go, I suppose. Yep. First of all, this is what it looks like. The breathalyzer device, the one you make your test in, looks like this, a little air pipe. And this is the way you do it. And okay. So you have this application on your telephone, which is called Predict. And what you do is you find the application, you click the application, and you enter your PIN number to access. And you get these choices, and the test is under the button My Tests, of course. And I have already performed my scheduled test today, but I can always make my own test. So I click this button, and I will get all the instructions from the telephone how to perform my test. So it says, please start breathalyzer. And I push the button on top of it to start the breathalyzer. And it will connect with the telephone. And when it has connected, it says begin to blow. And it will take a selfie to document that it's me who is doing the test. And it will make some calculations to see if the concentration of alcohol in my blood is below the limit which was set by the healthcare professional, and it takes about somewhere between 30 seconds and a minute before I have the test results. And when it comes up, it will be displayed as a happy face or an angry face. And apparently I am sober, and I get the message that I'm very good in Swedish. And that's how easy it is to perform the breathalyzer test with Predict.
So could you please tell us, Marcus, a little bit what you do more with Predict?
Yeah.
Except for the test. So the tests, they are most often doing like 3 times a day, right?
3 times a day, I think, is a common schedule. But there are other things you can do. For instance, I push my day here, and I have a bunch of questionnaires and assignments to do. I can choose this one, which says bicycle. My caregiver wants me to ride my bicycle once a day just to catch a bit of air. And I just push execute, and I get the message why I should do my bicycle ride, basically because it's good for me. And I execute, and I get the message that I have carried out my assignment. And there are other assignments about my well-being. Let's choose this one. And here I am presented with the slider, so it's easy for me to give feedback on how I am, how are your day, and how is it going with your family. Maybe not so good, like that. So I can do all my questionnaires like this. Let's go through this one a little quickie. Someone is trying to call me. There we go. Other assignments for me to do, my well-being questions. How was your day today? It's a good day. How did you sleep? Well, pretty good. Yeah, you get the picture. So I just go through this.
And the idea here is that you kind of on a daily basis will do all this kind of measurement. And of course, now we have a lot of activities for Marcus just to show, but they have a few kind of daily activities. They have a few questionnaires, but it could also be kind of in these assignments. It could be like small movies, instructions.
Yes.
So it could be kind of how you do mindfulness, or how you kind of programs for how to get back to good sleep, or it could be kind of motivational small talks. It could be small kind of reading instructions and so on. And everything here is a possibility to create a very digital program where you feel a lot of kind of good things for the patient that they perform in their home. And then you can just bring back the information, and then you can analyze it very smoothly and get to kind of on top of if Marcus is performing his assignments, how he feels about the assignments, and what's going on. So the kind of session I will have with Marcus will be really kind of powerful, because I know exactly what he likes or do not like, or what's going on in his life. So instead of spending half a year figuring things out, we could kind of in a very short time get on top of what's the problem, and the original problem for Marcus, so we could try to solve that. And then we give him new assignment how to kind of change this behavior in a new way.
Yeah.
And then I think it's more things that you could.
Yes, I would also like to show you, because sometimes there is a requirement in the treatment plan to go to a meeting, Alcoholics Anonymous, for example, and all these meetings, their places and time schedules, we have collected all of them and put them into our database. And so if you would like to go, or if it's if I need to go to one of those meetings, I just push the meeting here to meetings, and the application will present to me all the meetings which are close to me. Let me see here. Oops, here we go.
And then you can do like check-ins on those.
Yeah.
To show.
For some reason, can't find any meeting close to me, but if I was close to a meeting, close enough, it would show up here, and I knew it will display where for me to go, and I could check in just by pushing the button check in. And that way, the information about me, or at least my telephone, that it has been on the meeting at the right time and at the right place, and it will be accessible for the caregiver to look at that information. There are other things for example, my tools. There is a button called my feelings. Mm-hmm. Would you like to?
Yeah, I could just give a short kind of, it's also if you work with, I don't know how many of you that are working therapeutically, but it's a way to catch feelings digitally and train the patient how to kind of do their feelings. So that's one thing they could do. And is that when you have they are trained to kind of, when they experience feelings, which quite often could be a trigger for relapse or that they start drink again, they should be aware of what kind of feelings and how often, and they will be trained how to kind of work with the feelings in a new way. So you just press that one, and then you said, perhaps I got really angry, so I just press, or I'm depressed, let's say. You have to press there.
Press.
I feel how strong was the feeling. So it was really strong. It was a 9, for example, or 10. Yeah, it will be fine. And what was the feeling in my body? I got headache, or yeah, we said headache. And then I was we go up. I was at home when this happened, and I was alone, and I handled the situation really bad, so to say. And then I could also write in my own kind of notification, but we just put next. And this will be registered. So first of all, it was kind of get the patient aware how to handle feelings. And then they will be trained how to kind of handle these feelings in a better way. And then they could start measure also. So this will also be displayed for the healthcare provider. Also, if they press this help button, they will get activity, displays how to handle a craving. It could be a movie and so on. And they will have like diaries and these kind of things that they can fill in on a regular basis. So it's a lot of other things that will be collected and that will be displayed. That means that you could have a very kind of efficient meeting, and you can kind of directly know what's going on for Marcus and me or for the patients. So it will save time for the healthcare professional. It will engage the patient in a totally new way, and most of the care will be performed by themselves at their own places, so at distance. And you can use your resources in a totally new way. and kind of point them towards the ones that are in really need of more care. And you could.
And the information is easily accessed for the caregiver at the moment when the thing has been carried out.
And we have, as I said, we are right now in Sweden and soon have 50% of the market. And we have also started in Finland and in Norway. And now we are kind of looking into Holland and see how it could fit into the system there as well. So I hope that you will have a kind of better understanding of how this works. And now we also have time for more questions. And in case you won't have a question right here and now, you can send it over to MedScaler, or you could send it directly to us here at the Kontigo Care in Sweden. But I think it will come more information regarding that. So thank you very much for this kind of listening to us. So let's hope that you have some kind of questions.
Yeah, there are different questions came in during your presentation. The first one is from Susteus. She asked, was this used on patients with low intelligence? Do you have any results in English?
No result in English and published results. However, since the kind of, it's a lot of patients we know that have a mixture of mental health and some addiction problems. And we have seen, or the experience from customers that has worked with the patients with other disabilities have seen that it's kind of a good tool to work with them, because you could work with like emojis of sending messages. You could talk in, for example, your diaries instead of writing them. So it's a lot of patients that's normally excluded from treatment in a way that you're supposed to be able to read, to write, to understand a lot of things. But as soon as you explain how to perform a breath test, most people can handle it. We have a patient here that has been far over 70 and not used to mobiles at all, but been able to handle it. And also that you could work with like questionnaires with like happy or sad faces and so on. So when it comes to, we do not have studies that really could show it at this point, but we strongly believe that this is a kind of a really great tool working with people that in one or another way have problems with both kind of talking, but also kind of perhaps reading and writing disabilities.
Okay. I hope that answers your question, Sus. Then there's also another question from Roelle. She asked how many people are using the app. You already mentioned the market percentage, but I don't know if you also have the exact numbers.
Since we are kind of on the stock exchange market, so we're not supposed to kind of let out, but it's been people over far over thousands patients that have been using it at this point.
Okay. And then another question from Sis. You mentioned about the social support. So she asks, how can you use your social support system as a patient in the app? I think you probably will want to answer this.
Yeah, so if I got the question right, it's possible to engage, like it could be family members that will have this kind of notifications from the app in case the patients are not performing their test, or if there are alcohol there. It could also be that if you have like cravings and these kind of things, and you put the patient are pressing that button, it could go both go to the healthcare professional, but it could also go for the family members or a friend or a sponsor from AA, for example. Or some have actually their to the workplaces, which is kind of, if you're supposed to still work here for us, you have to kind of participate in this program, and you have to show that you will be sober during work time.
Yeah, exactly. Then another question from Rose. She asks, how patients are generally busy with the prefix? So how much time does it take every day usually?
It depends how kind of much of activities they put for the patient, but normally patients perform like 3 tests a day, and a test that's shown by Marcus is like 1 to 2 minutes. So like if you have 5 to 6 minutes a day, then you have performed kind of an important assignment, which is the breath test. But then of course, then it could be like assignments of doing activities or taking medicine or kind of answering the diary and these kind of things. And then of course it adds on. But still, since you have it in your mobile, with a few activities, you could kind of get a lot of treatment with still very small time per day.
Yeah, okay. Then another question from Suze. She asked whether the dashboard is integrated with electronic client file system, because in their organization they don't use standalone apps.
Yeah, so in Sweden at the moment it's used basically as standalone, but we have looked into the integration possibilities, but it will become more and more asked for, and we see as it is built, it's possible. So if we have kind of big customers that have a system that they would like to add it in, it will be possible.
Okay. I hope this answers all your questions. Specifically Suze, because she had a lot of questions. I hope, yeah, this answers all of them. If you have any additional questions, you can always drop them in the chat, or if you want to ask more questions, you can also maybe turn on your camera and ask them yourselves. And if not, maybe you have still some, I don't know, closing notes maybe you want to share.
Yeah, I think what would be asked quite a lot in Sweden is how could we kind of how could we use it in an optimal way? Is kind of a lot of people asking for what kind of patient is it most kind of beneficial, and how it is used. And we have seen in Sweden that some are using it on really kind of clients that have severe problems, and it could work really fine. But we also have those that work with kind of light patients that just need a small support, and it works there. And still we do not have kind of evidence for which patient group that it's most beneficial for. But it actually works for the whole kind of span of patients. But sometimes you need to be in the kind of motivation window to be able to get accessible. So we have kind of light patients where it fails, but and we have kind of those patients that we believe that it won't work on because it's so severe, and they could start working. They have been kind of years after years with kind of really bad problems, and they could kind of really go back to life again, which is really fantastic. So that's a question that is often asked here in Sweden, at least. And then it's also asked how much time to implement and to train the patients. And I think, Marcus, you're the best to answer there, but I think with just kind of very few introduction presentations and going through the system is very self-intuitive, so we do not spend that much to train healthcare professionals to get it going. And also for the patient, they have a kind of a first session where they explain how it works and show how to perform a breath test and so on. And most often the patient will start from that and continue working. So fairly little time regarding that.
And if there is any questions, we have a very accessible support department to take care of it and help. Yeah.
Yeah, an additional question just came in from Rose. She asked how the app is protected when it comes to privacy.
Mhm.
Because she saw that you need a PIN code to enter the app, or maybe that's, I don't know if
Yeah,
she saw
it's a
that
very
correctly.
relevant question, and it's also asked here as well, since GDPR and the patient kind of safety is really important. So it's built together with the kind of guidelines from one of these very well-known bureaus in Sweden, working with this kind of patient integrity and safety. So for the healthcare provider, it's like a two-factor part where you log into the system, and for the patient first is a code in to that, but then also the information is directly sent over to the healthcare professional, and it's cryptated according to all cryptation kind of rules that applies. And then it's kind of designed by safety. It's called kind of how to design in optimal way, all from cryptation to how to store data, and how to kind of also further on how the data is stored in the database. So as soon as the patient is kind of entering out from the treatment, the information from the patient and this kind of information will be, it's not possible any longer to trace the patient and so on.
Okay, and then another question.
Yeah, it's also a medical device, so it's built according to the standards for EU when it comes to medical devices. So that is also something that we've been really putting a lot of attention to.
Yeah, exactly. Yeah, then another question came in, a question about stigma, because there's a lot of stigma around alcohol addiction, and whether people feel ashamed when using this platform, or whether it helps to reduce this feeling.
It's one of my favorite questions, actually. It's really amazing what new technology could do when it comes to this, because for quite a lot of people, they do not want to enter the treatment because of the stigma. So they don't want to go to the healthcare provider in case someone would see that they go into clinics, and also if they have to go away for rehab and so on. With this technology, you could be whatever you are, and you do not have to put in any excuses for going away, for doing measurements and these kind of things, since you can do it whatever you are. If you are kind of having the stigma, even in the closest surrounding, then most people go to the bathroom and perform the breath test there, if they are on the workplace and so on. And we also had a small kind of it was exam work performed from the university in Lund, where they just looked into stigma, actually, and how electronic devices could kind of be a new way of working around the stigma. And we often get feedback regarding this, and in one or another way, after a while with having this, is also kind of increased so to say readiness to face this as a disease. So they start kind of feeling ashamed for the disease and themselves, but by using Previct and a new tool, is more kind of like a real disease. So it's kind of a way of measure. It's same as you have like diabetes and so on. They could see themselves more as patients instead of kind of bad behavior, or not possible to control the drinking, which is really also amazing to see how they kind of get they could, when the healthcare provider show them their kind of own graphs, as I showed you, and their kind of how they perform their activities and so on, they start to see it more as a disease, which encourage them to be more open about the disease. So first of all, is kind of something that they could hide in a good way, but after a while, some patient is more experienced, that they get more open and actually show in public that they perform this, and they talk about this as my disease. So this is really cool, actually.
Yeah, very clear answer. Nice.
I think with that we come to the end of this this webinar. Time's up. We don't have any questions more, I suppose. I would like to thank Marcus and Maria for their presentation and the wonderful product you made, and I think it can be very helpful in the Netherlands as well. Dorian and Nadia, thank you as well. And if the audience have some questions, please send them in or by email, and we will respond to it by Marcus and Maria. So thank you all, and bye.
Bye bye.
Thank you.
Bye-bye.